All right, welcome everyone. My name is Dr. Basil Constein, and we are doing a lunchtime webinar today, Writing as a Nurse, Social Determinants of Health. This is a targeted webinar. It focuses on a specific assignment and uses that to explore the larger question of how do we get the data to make truly evidence-based informed decisions. We're going to review a couple topics along the way and let you out with a little bit of time to spare because we realize your time is precious and lunch breaks are never quite as long as you want. So we have just a couple more webinars left in our schedule for this term. We have Beyond Summary, Adding Analysis and Synthesis to Your Writing coming up next Tuesday, and then another webinar in our EDD in Progress series the Tuesday after that. We have a whole slate of webinars coming for next summer, for the summer one term, including a number of brand new ones for our Writing as a Nurse series. So look for those in your inbox. And if you're wondering what do we have now and does it tie in with the course that you are taking, I've prepared a list here on this slide that will show you all of the currently available recordings for our Writing as a Nurse webinar series. So we are trying to code these as we go along so you can check and see, oh, I'm enrolled in, say, Nurse 631 next term. I know I can look and put this on my calendar to watch that right before I do the assignment, for example. Or if you are coming to Nursing 733 down the line, you know that there's going to be something there available. So we are adding more detail there so you can see the exact assignments that are referenced and look that up very easily on the Writing Center website. And with no further ado, let us dive into those learning objectives because, as I said, the lunch break is never as long as we like, and I know there are other things you may need to do during this break, like, say, get a bathroom break. All right, so we're going to start out with a review of key concepts before we dive into discussing the Nursing 648 assignment. And then we are going to move into looking at this question of how to locate community health assessment data. So the key concepts that we're going to start out with, well, let's talk about evidence-based practice. Now, this is something that comes back again and again in the program and is a huge part of the doctoral project that you eventually write to complete the DNP part of your studies. And so it's something that bears a little bit of time now just to make sure we've enforced that. So evidence-based practice is defined by Duke University as a three-part model where you integrate clinical expertise, the best research evidence that's available, and patient values. And you take all three of these factors or types of factors into your decision-making process to determine what kind of patient care are we offering. Now, this is ultimately about how you apply the things that you know on the job from your research, from your reading, and what you get from the patient, and to determining what's going to happen with the regular ongoing patient care that is delivered. The way that the course materials happen to describe this, they call the clinical expertise professional judgment, because it's the best research evidence, the best evidence, and patient values, patient preference. There are a lot of different write-ups about evidence-based practice, some of which will spell things a little bit differently in how they describe them, and some that will give you more sub-factors, but the idea is still the same. We're looking at what you know as a working nurse, what you know from the research literature, and what you know from talking to the patient and knowing what they want. And there are lots of things that factor into the assignment we're looking at, but we're doing a particular focus on the social determinants of health. Social in this case meaning not the fun stuff that we do and that we're looking forward to doing with people in person more on the other side of the pandemic, but all of those things that surround a person in larger society. The Healthy People website, which was originally designed to conclude 2020, so some of that stuff is no longer online. The Healthy People 2020 website described it as this: social determinants of health are the conditions and the environments in which people are born, live, learn, work, play, worship, and age, that affect a wide range of health, functioning, and quality of life outcomes and risks. Now, I know that most of our students in this program are located in Texas or thereabouts, so probably if we said the worship part, it's no surprise to you. But if that doesn't happen to describe you, and you are wondering what about the worship part is, when I taught in Tennessee for a year, a lot of my students and their patients would spend practically all of Sunday at church. And, you know, about 14% of your time is a large portion. And it's no surprise that that has an impact on what you do. Now, that can be positive or negative, but it can certainly affect your health. Now, looking at different models, you can see on the right we have a visualization that breaks this into 5 sections. The common list you'll see as few as 5 and as many as 21, and it's all about how you cluster these things. Here's an example that breaks the determinants into 6 broad categories: economic stability, neighborhood and physical environment, education, food, community and social context, and the healthcare system. I like this one because, to me, this is the most logical way of sorting this out. You'll find many different ones in the literature. The important thing is when you list these out and you say there are X number of categories or X number of social determinants, that you ground that in the specific source that you are referring to. So people who are wondering why you have, say, 18 instead of 21 can go see that source and say, they combine these things together. And it's also helpful to keep in mind that this last item, that the exact influence that the social determinants of health have will vary based on your community, your location, and other factors. And we'll talk about that more in a little bit. I grew up in the Boston area first, but I was born in the suburb of Newton. Now, if we go to Boston itself, there's a neighborhood, Chestnut Hill, that's right next to Newton, and there's a lot that's similar, but you've got different schools. And if you go further east in Boston, eventually you end up in Charlestown, where Charlestown today is a affluent kind of commuter neighborhood kind of thing. When I was growing up there, that Charlestown was very much a working class, not quite inner city, but very much a working class neighborhood. And if we went 2 neighborhoods south, we'd end up in Dorchester, which was, shall we say, entirely different in its character and the socioeconomic confluences compared to where I grew up. So you can be in the same general area, but we look at the specifics, find that there are a lot of different social determinants of health. Like, say, if you are located next to a factory, if you are located next to green space, what transportation options take you to different things, so on and so forth. So a big part of doing well-informed, evidence-based practice is understanding the exact context that you're working with and what data applies. So let's look at the assignment for Nursing 648. This is the Week 4 Assignment 1, Impact of Social Determinants of Health on your Evidence-Based Practice project. Well, these instructions are reasonably concise. For this assignment, you will use your proposed PICO question, that's the one developed in a previous assignment, your proposed PICO question and variable table from the previous assignment to develop a 3 to 4 page paper that should include an introduction, describing what the social determinants of health are and why they are important to address, describing the population of the organization in which you would pull a sample to complete your project and collect your data, and then use organization, county, city, region, or state level community health assessment for specific population data, and discuss to what extent 3 different types of social determinants of health impact your potential population. Now, I've had students come to me before and say, I'm trying to cut down my paper, it's 7 pages long. And usually this is where things go astray, where they list off the social determinants of health, and then they start writing about all of them. what we see here, it's the question is, or the prompt is, discuss to what extent 3 different types of social determinants of health impact your potential population. So you're being selective. You're picking 3 that you view are important to consider in this particular context. And then to discuss how a DNP prepared nurse can change organizational processes to incorporate these considerations in the policy or procedure development. So usually I find that the introduction, not a problem. Defining what the social determinants of health are, provided that you use citations that match the particular breakdown that you're giving, not a problem. Describing the population and the how to find that data, that's usually where people have trouble, and so that's what we'll spend most of our time on today. But again, remember, focusing on 3 different types of social determinants of health. And then discussing how a DNP prepared nurse can change organizational process, that's usually maybe 2 paragraphs or so, so not too much trouble. Keep in mind this requirement that the sources be less than 5 years old. This is where some people sometimes lose points, where they go and grab data and it's much older. And yeah, there's a certain extent where the data will always lag the present, but we want to go with the most current literature that we can, because again, for evidence-based practice, we want to have the best research available and the most timely and most current. There are some neighborhoods in the country that in the course of 5 years through gentrification will entirely change in character. You find all these little houses or crumbling apartments are gone and they're nice fancy condos and stuff. And like, well, things have changed a little bit. Depending on when you grew up here or whether you moved here, you could have very different background. And based on whether you are struggling to keep up with a rent or you moved here because you thought it would be fashionable and your income is much higher, you may have much different access and experience with healthcare. So let's keep our data especially current. And then this rubric is pretty straightforward. It just breaks down all those things before and says, make sure you do all of them. All right, so let's move into the main part. And this is the part that students requested that we add this webinar for. This is to talk about how to locate community health assessment data. So first is, well, who is collecting this? Clearly, you don't want to go and grab this yourself for this assignment. There are TMP projects where people go and collect new data because of a gap of some sort. But for community health assessment, for this assignment, only having a week to do it, we certainly want to work with existing sources because everyone has lots of other things to do. So who will be collecting this? Well, governments, for starters. Not only are there legal mandates, but they're usually required to make this available to the public. And these days, that means it's almost all available online, usually without any sort of registration or a login required to get the raw data, which is great. Research centers, which are usually but not always based in universities, are often collecting this. If it's university, usually the data must be made available on request because it's being collected using funding that stipulates that. A lot of foundation and certainly federal funding stipulates that now. And hospitals will often collect stuff on their local community, and community care organizations of many different sorts. So how are you going to access this? Well, first question, is it publicly available? And I would say for this assignment, I'd steer you strongly towards, can you just go and get it right now? Again, because there are plenty of other things to do. For a larger project, if you're working on your DNP project, there is a lag where you may notice that they only publish the data at certain increments every year or 5 years or 10 years sometimes for census things. That doesn't mean that they don't have some data in the middle, so you might be able to request something that is available to the public on request but hasn't been published right then and there for you to grab without having to ask. But for now, I'd say stick with is it available right now? And is it something that you can find documented in a publication? We'll look at an example in a moment. But if you see the existence of data being referred to, a note for a table says, oh, this is the source, chances are you can track that down. And is there some data that you can obtain directly from a researcher or from an organization? And this came up just the other day when I was talking with someone who was saying, oh, yes, there's this data set. I wish I could use it. It's got 10,000 people in it, and it's got so many questions that they asked people over a period of several years. And I said, oh, well, if we look at the notes here, this data set is commercially available. You can purchase it from this firm. And we looked at the pricing, and it was something like $75 for that. In which case, they just got out their credit card and they purchased it and said, okay, well, I have all this data set and I don't need to ask the IRB for access because this is already being screened by that company, and great. Now, again, we're going to go with is it public available? Can we go with it right now for this assignment? Because there's only a week to do this assignment. So here are just a couple examples that I found of some gateways to data that you can find just with a quick internet search, looking for data at the federal level, the state, or the municipal. If you like to look at a community around our mother campus in Abilene, Texas, you can follow that last link there. But I mentioned that we talk about how to follow the trail from a publication. So I found a website that was giving information on Taylor County, Texas. And if you look at the bottom, you'll see that it says the source is the National Center for Health Statistics, the natality files. So that's about births. And it even gave me the date range that was used. I'm like, oh, well, the National Center for Health Statistics is a federal organization. So I spotted that source, went and looked it up, and I was able to access that. And in fact, let's go ahead and I'm going to share my web browser, and we are going to search for National Center for Health Statistics natality files. All right, I'm switching my sharing over to my web browser, so you should see that instead of the slides here. And you'll see that we have a couple related things here, of which if we just want to see the natality stuff, we could see this kind of dashboard here. So let's go ahead and look at this. And you'll see that it talks about the data. You can see the forms that they use for collecting that. So if you're wondering, well, what are they asking? Well, we can go ahead and look at the specific forms there. But you can also go here directly to the data. And where does that leave us? Well, we get a snapshot. They'll give us a table. And at different points on the website, you can actually go and download Excel spreadsheets with this raw data. All right, so this is the point where I want to ask for suggestions for where I should look for data here. I have an example that I'm going to look at myself, but if you have an area, a region, a population that you are yourself interested in, let me know by typing in the chat window, and we will look at that. I am interested in the social determinants of health for Hamilton County, Tennessee. Now, Hamilton County is a county in southeast Tennessee. If we look at this map here, you'll see that this is located very close to the southeast corner, and we're right on the border with Georgia. Now, I happen to know Hamilton County because I lived and worked at the University of Tennessee, Chattanooga. And it's a place where what you have within the city and the immediate suburbs is very different from what you have out on the edges here. And so I was aware that there were very different social determinants of health in some parts of the region than others. So let us go ahead now and look for social determinants of health, Hamilton County, Tennessee, and see what comes up. And you'll see that one of the first things that comes up here is health data for the Hamilton County Health website. Awesome. Now we also have information down here from the state of Tennessee. So we'll look at both. Let's start out with the Community Assessment and Planning health data. And you can see they have reports. If we looked at this, this is going to be more, this is an extracted thing, so it's not giving us the raw data tables. This is more a summary of key things. Now, if we get down to table 2, they gave us some stats that they've run on that. Great. But it's still not giving us the big data tables. So you might need to do a little bit more looking around to find that. And say if we went to demographic and social determinants, so now we're looking at things like how is the population banding in different ways? How does this compare to the county 13 years ago from the snapshot they're using here? How does that compare to the state as a whole, the country as a whole? So let's just go ahead and look at the diversity of this county measured a couple different ways. Now, we don't want to use this column here because that's Hamilton County 20 years ago. But it's helpful to look at the trends and compare it to this one here and say, okay, well, there are about 10% more people there, about the same proportion of kids. There was definitely a slowdown in there. Got an aging population. Okay, that's increasing. And we weren't tracking that disability thing, but we are now. And that's actually a higher proportion than I was expecting. It's less than the state average, but it's a bit more than the national average. Okay. And here's an interesting trend. The increasing percentage of a language other than English spoken at home. And I can tell you from living there that it is mostly from the increase in Asian and Hispanic immigrants to the county, people who are arriving from other places. And so this means that Spanish speaking is actually increasing a lot in the schools, which can inform lots of things. And it also informs your medical outreach a great deal. And we've even had at least one student in the program doing research on this region before. So now what's also going on? Well, the median household income has gone up, but look what's also happened to living below the poverty line. So if you are looking at what the social determinants of health are for this region, definitely something that's concerning is how this percentage has increased rather dramatically. That's up by more than a third in the 13 years in between the 2000 sample and the end date for the data we're looking at here. So this, certainly you can find a lot of interesting things to talk about here. And if we look down here, they even have a report where they've discussed some of it as, oh, yes, we have a fairly large group of Hispanics coming from Mexico and Guatemala. This would explain, among other things, why the Mexican restaurants were so great while I was down there. Now, I wouldn't say that it's quite as lovely as you get in Texas, but we're all particular about that. So there's a lot of data here, and on the county website, you can find a gateway to many different sets. And they even have this data sources and where to find data if you're looking for comparative things, or you're trying to get stuff specifically administered and collected by the county. And most counties nowadays will have something of this sort, although it may be gathered at the state website level instead. Speaking of which, let us back up. And you see here we have the health disparities for state of Tennessee website. So let's go ahead and look at this and see what we have here. They recommend looking at the CDC's Social Determinants of Health website for data. Great. And then they list their government partners, often which are collecting data on this. And I will say that the Kaiser Family Foundation, you will see them listed a lot as a source for data and graphs because they collect and collate a lot of data related to this. Let's go ahead and we're going to go and look at we are going to go ahead and look at some other things here. So I'm going to add the word state here. We get much the same results. Okay, and I'm going to add the word data. And again, we get much the same results. But look at this here, exploretnhealth.org. So if we go ahead and look here, you'll see that there's actually this website that's being designed to let you browse a lot of related data. So I can go ahead here and look at Hamilton County and ask, show me the data indicators. I can select which ones I want to see. And you see that these are sorted into different categories. And now I'll go to reports. And you'll see that it is giving me a snapshot of all these things. And if I wanted to compare multiple ones, I could select multiple counties here. But this gives me a nice way of quickly pulling stuff on an area, especially if you're looking to see, well, is this one that I want to study? And like, oh, yeah, I'm seeing that there's a notable food environment index score here. And, how do we relate? You can see that there's this huge change if we go to a different county versus where we are right now. And in fact, let's go ahead and let's say that you just decided that limited access to healthy foods was something you wanted to focus on for your description of selected social determinants of health and their impact on this population. So let's go ahead and look at this here. We have, okay, the number of people, the population with limited access to healthy foods, 41,000. That is roughly between 1 in 7 and 1 in 8 people in this county have limited access to healthy foods. And I believe it. I've spent a lot of time walking and running and biking through Chattanooga, and there are areas where you don't have anything except a gas station, convenience store for groceries. And that is many things, but it usually does not make it easy to get fresh fruit and vegetables. So we see that this is giving us the general situation. Let's look at the larger map here. And if we were to scroll out and look at the state as a whole, notice that Hamilton County and its neighbor to the east are a different color than some of the other counties around them. So there's something particular about the conditions in Hamilton County that set it apart from many of its neighbors. Now, I will tell you that one of those things from living here, if you drive through it, you'll find that often you get these pockets around a city, but not always, because we've got this cluster up here, which actually is probably for the capital, for Knoxville. So in this case, Chattanooga as an urban center kind of sets the pattern for its eastern neighbor, where we have Cleveland, and a lot of people working in Cleveland are commuting to Chattanooga. So this is how the urban center is driving things for the larger two-county group. And you can probably guess where Nashville is in this mix. And let's go ahead and back up here. You'll see that there's add data if you want to be cross-referencing other things here. We're going to go back to our earlier search and look at another thing. So excessive drinking, you'll see that's it's kind of in the middle. Strangely enough, there's more drinking going on to the east and to the west. Not sure what the story is there, but sometimes it's religious, where you'll have certain denominations that practice or promote temperance, and that they happen to be more present in that region because of historical things. Sometimes you'll find something like this. If we go down here to drug overdose, I am happy to say that Hamilton County has a lower percentage than normal for that. It's a terrible thing to have and a countrywide problem, but that one, at least, it's coming up ahead. So let's look back at the assignment for a moment. If you were looking at the social determinants of health that are being singled out in this assignment, at least 3 different possible social determinants of health, discussing the extent to which they may impact the potential population. So impact by itself is neither positive or negative. Impact means it's hitting it, or in this case, having some effect, some change. So that could be, we're looking at the lower drug overdose thing, which is a huge impactor on individual health, on saying, well, okay, so this is a positive impactor. And then, for example, the food desert thing would be a negative impactor. So you have to look at these and interpret them. You don't want to just list them and say, this is an important determinant. Well, tell us which way it's bending things. Unfortunately, the vehicle crash thing, there are a lot of more rural counties where the rate is a lot higher, and that's unfortunate. All right. You can see we've got a number of things here. I'm actually surprised to see that our sleep thing is as low as it is, but hey. And then sometimes there are combined things here where you'll have, it's combining multiple measures to come up with a score, and then use that to try and get an idea of how healthy people are compared to their neighbors. And then I'll say with some little local pride, like, okay, well, our health behaviors as ranked here, looks like Hamilton County is doing pretty well. Yay us. And that probably has something to do with, there's a lot of natural beauty, there's tons of hiking, biking trails, fishing streams, and all these kinds of things that will get people outdoors and exercising. All right, and clinical care. Well, this is a good thing that it's up there, because there are not only some major hospitals, but building a new campus for a new clinical site for the University of Tennessee medical system there. So I hope it's doing well there, and that it is in fact doing great. You notice that this neighboring county here, no, but that's also a relatively short drive into Chattanooga. Cleveland, depending on how fast you drive, that might be a 40 minutes. So it could be worse, but also could be better. And you'll see the other breakdowns here. And again, you get to choose which ones you discuss, but it's probably one where you want to say, well, this is something that is not just in the middle. This is something where it's very high or very low. All right, preventable hospital stays. That is a really interesting one. I'm curious to see how that will change in the future. And so you see, there's lots of data here. So now let's look at where it's saying this is coming from. And they even have a link. They're saying, this is coming from the University of Wisconsin Population Health Institute. Also one of those university centers we're talking about earlier. And they even have a link to it. So I can go ahead and follow this and say, oh, well, I want to see what they have, what other information. And there's also this show more details link, which will tell us a little bit about that source. So let's go ahead, and this will be the last thing before I let you go to enjoy the rest of your lunch. So let's put in a arbitrary zip code here. I'm going to pick my zip code in Minneapolis here. So this is Hennepin County, Minneapolis. You see, I just punched in the zip code, and I could download the data here. That's going to be they give me the option of a summary report. I can get this raw spreadsheet. I can get a map. So if you wanted to just do your own analysis with the data, you can grab it. And they have annual data. So this is great. You can absolutely ensure that what you have is recent when they're giving you all this. Now, there's some things to note, like here in 2015, sorry, wrong year. Where was I looking? Oh yeah, here 2015. You'll see that in addition to the other things you see for every year, there's this health gaps report. Now, it might be that you find something like that is only available at certain increments. Usually they want to look at the trends over time, and here's how we were doing the last 5 years or so. But again, they're giving you the raw data. So for the purposes of this assignment, I just go with the most recent stuff. So in this case, let's look at the summary report here. And so they give us all these stats here in this table. Let us say that we are looking at adult obesity here. And we'll see, all right, Minnesota is doing better than the country as a whole, but not as much as I would like. Same thing with smoking and with healthy food. We're 1 to 3% better in most categories, but that's not really something where you should just go pat yourself on the back and say we're done. That's got some stuff that we want to do still to improve. So there's lots of data that you can use to identify and how granular we're going to get. Let's say city of Boston. Let's see what they have, which Boston's a pretty big city. And we find that they do have reports and data sets prepared here. And in this case, this is a detailed chapter on health in the city of Boston. And we can look and see, where did they get their data? They got it from the American Community Survey run by the Census Bureau. So you could look that up if you wanted to get that specific set of data. So that concludes our presentation today. I hope that you've got something useful out of this. As always, feel free to visit the Writing Center. We are happy to work with you at any point in your projects. And if you would like to set up an appointment, just go to our Writing Center website and fill out a reservation. We do get pretty busy at the end of the semester, so don't wait too long on signing up. But again, thank you for coming. Have a great rest of your day.